Hi, welcome to Postpartum Foundations for Healing and Resilience. My name is Shauna Hoke. I'm a pelvic health physical therapist, and this is the webinar version of which is also a in-person workshop, where we'll be doing a little bit more moving as well. Today is a little bit more just learning about um, how pregnancy and delivery affects pelvic floor and learning about how is the best way to go back to exercise and movement. So let me just switch my screen here. Um, so, a bit about me, I'm a physical therapist. I've been practicing for just about 8 years. I do specialize in pelvic health for all genders, males and females. I also do breast rehabilitation and lymphedema rehabilitation. And I think most relevant to this webinar is I'm also a first time mom to a 12-month-old. And so I feel like this is a really particular special interest of mine in the last several couple years, just going through pregnancy and that postpartum phase, and kind of being able to relate to that uncertainty of like how to feel really confident going back to movement and exercise, and just like having that experience firsthand. And this is my little baby girl, Hallie. She's just about a year old now. So it's been a journey. She loves riding her little bike. So the goals for today, and again, this is the webinar version, so a little bit different than maybe during the in-person workshop, going through what is pelvic floor, what's the function of the pelvic floor muscles, how, again, does pregnancy and deliveries, that's vaginal deliveries or cesarean deliveries, either how that impacts your body, and kind of that healing time frame, and what that looks like over the course of weeks and months and even the year after giving birth. And then, in the in-person workshop, we could really work together to learn how to reconnect with your core, rebuild awareness, control the pelvic floor and abdominal muscles in person, like moving through that, getting those cues individualized for you, and hopefully just get a little bit more confidence on how to return to your normal. This is some people coming from backgrounds of being very physically active, very confident with their movement, and finding that there's a newness to moving after giving birth, and some people just have a little bit more confidence doing that than others. So, at any stage postpartum, whether that's just been a few weeks, a few months, or it's been even a few years, um, this is hopefully you'll find something relevant in this webinar. So let's start with what is the pelvic floor? And we can always start here because I think we're coming from all different backgrounds of awareness of like what are these group of muscles and what do they do? So it's a group of muscles and connective tissue at the base of your pelvis that form a supportive sling that is almost like a hammock at the bottom of your pelvis, supporting your organs and controlling continence and sexual function, bowel function, and both males and females have a pelvic floor. The one on the left here, that is a male pelvis, and then the female pelvis to the right. So pretty similar, honestly, similar muscles, a little bit different function for both males and females. So the functions, as I mentioned, supporting your pelvic organs, the bladder, the rectum, the uterus or prostate, whatever you have, and supporting bowel and bladder function because we're responsible for continence and voiding, and responsible for sexual function and core stability. So you can imagine how this group of muscles is affected both during pregnancy and delivery, and we'll get into the details about that too. It's important also just to recognize that your pelvic floor is part of a pressure system in your abdomen. And um, I like to think of it like a soda can. That's the common metaphor that we give for this pressure system. And the pelvic floor is like the bottom of your soda can. your diaphragm and your rib cage are at the top, and your abdominals that wrap around the sides. And it's just responsible for creating appropriate pressure depending on your activity level so that you can move load with strength and resilience. And you can imagine a soda can is like a closed system. And so if there's any leakage or weakness at any part, that's when that pressure system can start to malfunction. And that can be where you start to get symptoms. So the pelvic floor doesn't work in isolation all by itself. It's part of this system, working with the abdominals, working with your diaphragm and breath, and also your posture to just move you through space and move loads and do what you got to do with the most strength and resilience possible. So, talking about pregnancy specifically and how that affects your pressure system and how this affects like your soda can. So you can imagine when as the uterus grows, the uterus sitting right in that pelvic bowl will put pressure on the pelvic floor. So as it grows, and this happens very gradually, so our pelvic floor does become, stronger and adapt to that load over time. But certainly, it's a much higher demand than usual. Hormones as well can affect your connective tissue and support. There's a lot of fluctuations in hormones throughout gestation, and that can certainly just change how your ligaments and your tendons and your muscles, kind of their elasticity and how much, I guess, sturdiness is to that too. So that can be why some people feel like they do have a little bit more back pain, and maybe not even back pain, maybe just other pains in there and other parts of their bodies just due to that connective tissue change. Abdominal muscles also stretch a great deal, of course. That's also like that front part of your soda can. So they're putting a lot of stretch on that front part of your trunk and changing your center of mass. Just changes how your muscles are able to activate and accommodate load. And that also affects your posture and breathing. So growing uterus and taking up space all in that abdominal cavity, it makes it a lot more difficult to breathe. There's a lot less space for diaphragm and lungs to expand, and that affects your posture as well. So those pieces of it can affect again your how you manage pressures and move. And so this is a very detailed image of you can kind of appreciate that stretch of the abdominal musculature. And a nice, interesting fact, the abdominal musculature is stretched up to 115% of its resting length by 38 weeks. So that's quite a great deal. And of course, this happens slowly, and your body is able to adapt and change and evolve over time. But that's certainly, something to consider. Also, your pelvis, which is not pictured here, like your actual pelvic bones, that where they come together in the front at your pubic symphysis joint, it also naturally widens during pregnancy. And this is a normal widening that happens up to 7 millimeters at full term. But of course, sometimes there is extra widening that might happen that might also just put some more instability in that pelvic area. And you can start to feel aches, pains, and just pressure changes from there. So it's all within normal changes, but just to appreciate kind of the extreme of that change. This is a picture of the different abdominal layers. So sometimes we also don't think about all these different layers that might be affected again during pregnancy when there's that stretching, but also if you were to have a cesarean section and cutting through all those different layers of abdominal musculature and fascial support, that can make a difference too. So when we're talking about postpartum rehab as well, we talk a lot about rehabbing the abdominal wall, and that is what is included in here. So these deep layers, the transversus abdominis, which is pictured here. I don't know if you can see my screen. Yeah, there. Internal obliques, just superficial to that. And then your external obliques, your rectus abdominis, these are kind of like your six-pack ab muscles. Rehabbing the nuance of those and all the maybe different ways that you would want to load these muscles. And this is just a picture showing, I think many people are aware of diastasis recti or this like abdominal separation that happens. And the reality is that during pregnancy and as you're getting into full term and certainly right afterward, there is absolutely going to be separation there. You have to have the abdominal wall grow and stretch to accommodate growing baby, growing uterus. So this stretch is going to happen. The What we're looking for postpartum is that there is a healing and a recovery of that separation gradually over time. And there are definitely things that you can do to facilitate that and feel confident that you're contributing to that healing and not worsening any weakness along that linea alba or that fascial line that's coming between these left and right abdominal muscles. So just showing kind of the different variations of diastasis recti that could occur. And it just really means that this widening or stretching of that linea alba fascia in the center could happen sort of around the belly button, lower to, above, or just full along the rectus, the linea alba. And so it can be something of fear, I think, a lot of times that people come to me with a lot of concern about that separation and that being kind of like their biggest symptom, so to speak. But um, again, it's really quite common and almost expected during pregnancy and acutely postpartum. But if you are finding that there is visibly some separation or you feeling that weakness in the center, or you are suffering from some aches and pains because of that loss of strength here. That is something that, again, there's rehab for, and it's never too late to start. So now we're going to talk about deliveries and how that can affect. So that was pregnancy. How does pregnancy affect it? Stretching of the abdominal wall, load on the pelvic floor, widening of the pubic symphysis joint. So what happens at delivery? The pelvic floor musculature during a vaginal delivery specifically is stretched up to 250% of its resting length. So that is, again, quite a bit, and that is something that it's meant to do, and that's what it's designed for. But of course, there's always potential for tissue or nerve injury, and that can be for a variety of reasons. There's a lot of different risk factors that could go into someone's risk or outcome of a perineal tear. And we're not going to get into those like explicitly, but that could be episiotomies, use of instrument assists, so forceps or vacuum, baby's size, and also baby's position. So having the back of their head posterior or to the back, and there's just optimal ways for a baby to exit that could or could not contribute to risk of tearing. So I say tissue or nerve healing. So it's not just sometimes the tissue itself, but the nerves that run in and around the pelvic area that can undergo a great deal of stretch. And sometimes if there's like an overstretch of those nerves, that can result in nerve injury, which again would require just some healing afterward. And sometimes people are really aware of this and sometimes they're not. And I think it's something to just be aware of and know that exists, so that if you are experiencing residual numbness or changes in sensation with sexual activity, for example, um, or feeling extreme like weakness that doesn't seem to be recovering, that's something that might need to be specifically targeted in pelvic rehab. Pubic symphysis separation is also another possible risk during a vaginal delivery. So there is an unnatural amount of widening, but sometimes, of course, depending on, again, baby size, baby's positioning, kind of how the delivery goes, there could be extreme symphysis separation that could lead just to, again, prolonged recovery or needing to rehab um, abdominals to support, and may or may not come with some other aches and pains. So potential long-term effects of a vaginal delivery, and I think that there's a certain amount of expectation of what happens postpartum. Like, oh yes, there's going to be maybe temporary period of incontinence or soreness while things are healing, but looking more long term past those initial like healing weeks that people may still just attribute to that vaginal delivery, but might be a more of a sign that you could use some support for the pelvic floor or for the pressure system and seek help for. So potential long-term effects, again, the urinary fecal incontinence, pelvic organ prolapse, so that feeling of heaviness or bulging in the vaginal area with certain activities, decreased pelvic floor strength, so it's just a sense of weakness. Sometimes people will actually even, I would say often complain of like air or gas moving in and out of the vagina. And passing wind through the vagina is another common symptom. Changes in sexual sensation, as I mentioned, things just feeling a little bit different during sexual activity, and again, pelvic or low back pain. So that can the low back pain or hip pains being a sign of again just some imbalance somewhere. So for cesarean delivery, I think some people might think, okay, well, maybe didn't exit through the vaginal canal, and therefore my pelvic floor is probably totally fine. And that could definitely be the case. It is protective of the pelvic floor in some way. However, you have to think about how the abdominal wall and how that is affected during a cesarean delivery. So it's also again changes depending on emergency or planned can be the case, but um, it's an injury to the abdominal wall as with any other abdominal surgery, which results, of course, in scarring. Scarring can, again, depending on your activity and kind of rehab after, can result in a little bit more stiffness, like mobility deficit and or weakness. So changes in the abdominal wall there, stiffness or the weakness alters how you move, how you breathe, how you can recruit the abdominal wall muscles. So going back to that image where there was all those layers, and if things aren't healed, to its fullest, to and fully rebalanced, there might be some compensatory patterns that may develop that changes just how you do things and how you move, which again affects your pressure system. So if you think of that soda can again, and instead of it being like even and pressurized all throughout, you can think of like maybe a dent here or there or a weakness in the wall that doesn't allow for like that strength of that pressure system to carry you through maybe your those higher level activities or lower level activities. And so now I just want to talk a bit about the postpartum healing in general. And this is an effort to give you a more realistic timeline, perhaps. And I think that coming after your 6 week follow up from at your OB, there usually is this sense of like, okay, 6 week has passed, you are good to go. And in a sense, there is like a great deal of healing that does happen after 6 weeks, but there's a great deal more healing that continues to take place afterward. Uterine involution is that kind of 6 week period. I think that they are thinking about where your uterus is shrinking down, returning its to original size from its um, expanded state, and that does take up to 6 weeks. The recovery, though, of the pelvic floor muscles and connective tissue takes much longer, 4 to 6 months even. Again, depending on how also what you're doing in that time. I think everyone's really different. It really just depends on where you're coming from to like your baseline. But I appreciate it. Like up to 6 months. That's quite a long time. And I don't think um, we're necessarily given that framework on what to do during that time to help and support that healing. And then there's the hormones. Remember all those fluctuations of hormones during pregnancy, and then the crash of those hormones and deep and dive in estrogen like right after childbirth. Um, there's a lot of rebalancing that takes place 6 to 12 months even. So this varies a lot again depending on breastfeeding status, feeding status, and individual variations, but just kind of respecting that those hormones rebalancing also contributes to how you feel when you move, and like maybe some high intensity variations of workouts that felt really natural to you before and are not going to feel quite the same. It might feel like they take a lot out of you, and even just respecting the whole healing that happens. We can't just say 6 weeks and fly free. So I want you to think now, like, what are your specific concerns with your return to exercise? So whether that's you are just starting to think about it, you're postpartum, you're thinking about getting back into that park bar class, Pilates class, yoga class, group class, or even just like home workouts, weight training, running. Like, what are things that you like to do? Um, are you doing them? Are you thinking about doing them? At what point are you thinking about doing them? Do you have a sort of plan to get back to these activities? And how do you plan to like gradually go into it? And I don't not saying that there's one right way or there's a wrong way to do. Or maybe there's a wrong way going too fast too soon. But if you are wanting guidance, needing guidance, and feeling like that would just help with your confidence and maybe getting back to it quicker if there's hesitation too, just know that there's support for that. And during a in-person workshop, we can absolutely talk about those concerns of those who attend, and it can be more individualized in that way too. But think about your concerns, or maybe you are a few years out from having your baby and there are things that you have gone back to doing, running, jumping, classes, weights, you name it, and you're doing it, but maybe there's symptoms that come along with it, or perhaps there's maybe things are feeling absolutely wonderful, and that is great, and sounds like you're doing really well. So, you know, there is that outcome too. It doesn't have to all be like fraught. I think mainly too, it's important to remember that I think during pregnancy, it's very obvious to those, visually, like how they're feeling and what's going. There's a lot more, I guess, concern from others that maybe there's some modifications that you need, or people actually pull back in pregnancy, maybe even more than they need to. However, postpartum is where, there's, visually things are, you're not looking, but you're feeling ready. But knowing that the timeline that we spoke about, those months, that even up to a year or 2 years, where your body is still healing, and that you rushing into it not, is not recommended. And I'm not saying even to be fearful or to um, be super hesitant, but I think finding that balance is tough, and I think it's different for everyone too. So that's my next important to remember. It's going to look different for everyone. So really important not to compare yourself to your friend, your neighbor, your relative who is at their point in their journey, or what their return to normal for them looks like. It's going to really vary. Depends on your delivery, depends on your pregnancy, depends on how you what you were moving like during and throughout your pregnancy as well. So allow for that variation, and honor that too. And don't settle for lingering symptoms. So when in doubt, get it checked out. You don't, if there are things that you're dealing with, I think it is so easy, especially um, within community of mothers or family talking to each other, that things are chalked up a lot to, well, I had a baby, and so now this is how things are. And I'm really just here to say, like, that doesn't have to be the case. And that could be, again, freshly postpartum, or even years and years later, where people are maybe recognizing that these changes did sort of have a a pivot point, a pattern where it started after having children. So don't settle. Get things checked out early if possible, but of course, here when you're ready. So I hope that this gave you a little bit of framework for not maybe specifically how to get back to exercise. We that is something I wanna move through physically during an in-person workshop, but answering some questions on what this time frame can look like and maybe why that's the case, how pregnancy and delivery affect your body and to respect that timeline too. So if you have any questions at all, please don't hesitate to reach out, always, via email, or you can, come or go to our website for consultation, and I'm happy to field more questions. And I hope to also see you in person workshop where we can all move together. And this is just really good background to come into with. So thanks for listening.